A new designation for this winter's flu season as hospitalizations from the virus reach record numbers. The CDC has declared this flu season as high severity. That's a classification the government hasn't used since the 2017-2018 season. WBZ's Beth Germano looks at some of the reasons this year is so rough.
Just relax this arm.
Amerta Sidhu finally got her flu shot today, but only at the urging of her daughter in the medical profession seeing cases spike.
I feel quite healthy and maybe laziness, I think.
Not just a spike, but a high severity of flu cases nationwide, according to the CDC, for the first time in several years. And at Union Pharmacy in Newton, it's driving people to come for their shots.
Are people coming in already sick, or are they being preventative, or both?
Both, I'd say. I think when it hits a household or a neighbor or a friend, family member, I think it's motivating folks to come back in.
In Massachusetts, that motivation has been lacking, with only 38% of residents of all ages now vaccinated against the flu. But Tim DePratty got his early in the season.
Well, I'm in the restaurant industry, so I'm around a lot of people, so I make sure that I get all my shots so that I can just be protected.
Experts say this strain of the flu has a short incubation period and develops quickly. Not to mention, after a mild start to the winter, the temperature has plunged.
Came the cold wave and the snowfall that led people to move indoors, and as we know, all these respiratory viruses spread, in closed setting and congregate settings.
The silver lining is that COVID and RSV cases have not been on the rise, but flu cases, which peaked after the holidays and started to drop, have now done a U-turn.
We tend to be short-sighted, so we think if things go down, we don't worry about them anymore.
We have both pediatric and adult doses.
Union Pharmacy is administering at least 20 vaccines a day, double from a week ago, while patient visits to hospitals and doctors' offices are higher from any peak week on record.
I don't want to go to the hospital. That's one thing I don't want to be.
And while it may be mid-February, health experts say it's not too late to get the shot. In Newton, Beth Germano, WBZ News.